Hello and welcome to today's episode of Fly to Freedom. I'm actually super excited today because I have a guest called Erika. Is it Malm or Malm or?
Malm, like lip balm. Malm, yes.
Like Malm. Erika Malm, who has spent over 15 years treating trauma and eating disorders. She is passionate about supporting individuals, couples and families with effective care that is informed by recent developments in neuroscience. Hello, Erika. Welcome to my podcast.
Julie, thanks so much for having me.
Oh, you're more than welcome. I'm so excited to talk about all this. But first of all, I'd like to do just a few little icebreaker questions, which I forgot to tell you about before I hit record.
Oh, gosh. That's tricky.
So, what is your favourite smell?
Cedar.
Cedar. Oh, that's interesting.
It's so funny that you asked that question, actually, because I just hosted a women's retreat this weekend, and it was all about the senses. And one of the questions was, when you die, what is the smell that you want people to associate with you after you've gone? So I'm fresh off the press with thinking about that.
That's awesome. How strange that, well, it just must have been meant to be, hey?
Yes.
When you were a child, what did you want to be when you were growing up?
Actually, if you can believe it, when I was in fourth grade, I wanted to be a therapist. And
Amazing.
So, and it took me a long time, and then I left that for a long time, and it took me, but I think that was my calling. It took me a while to get back there, but yeah.
That's fantastic. Oh, I love that. What quality do you most admire in others?
Mm-hmm. Is that a quality? Compassion?
Oh, yeah.
Is that a quality?
Compassion is amazing. Has a book ever changed your life?
Yes, The Overstory.
The Overstory. I haven't heard of that. I'm going to jot that down. Do you know who that's by?
Yes. Richard Powers. I believe that's his name. Yeah. And it's about trees.
Trees.
Beautiful. Well, it's about trees and so much more. It's a beautiful book. If you can, I highly recommend it. But that.
Oh, I love trees.
Transformative for me.
Amazing. And last question, what would you say is the best piece of advice that you have ever been given?
Oh, gosh. I needed prep on that one.
I always save the toughest one for the last.
Best piece of advice I've ever been given. Oh my gosh, I've been given so many good pieces of advice. I think one of the greatest pieces of advice I got, I don't know if it was the best, but it comes to mind, so I'll just go with it, was when I was quite young and really unhappy and struggling in my job. And I reached out to my father, and I had this idea that you can never quit, and you stick with things and you stick with things. And he just said, "Oh, just quit." And he said, "Life is too short. You have to be with integrity," because I felt like the work was not with integrity. It wasn't being done with integrity. He said, "Quit." He said, "You'll find another. You will find your way. You'll find another one." So I don't know if quit is the right message to give to people, but in that case, for me, it was amazing, and it was so freeing, and it allowed me to move forward in a direction that was far more meaningful to me without fear.
That's fantastic. Yeah. No, and I do think that when we know something's not right for us, we need to stop it and do something that is right for us.
Yeah.
So,
yeah.
Tell us a little bit about how you got into working with people with eating disorders.
Well, Julie, it's not a story that I'm particularly proud of, or that anyway, I'll just tell you this, the way that I got, it was by chance, as unlike a lot of other people who come, it's a real calling and, to work with people with eating disorders. But I came to work with, I didn't have any interest in working with people with eating disorders. And I think part of it was due to fear. Part of it was due to cultural biases. But I was working as a social worker on the inpatient unit of a neuropsychiatric hospital. And as a social worker, you can only often do like discharge planning, which is a wonderful service. But I wanted to be doing therapy inpatient, which was very hard to do in that institution. And I was running groups. I started dipping my toe in the eating disorder unit because they needed someone to run groups. And then they offered me a position doing 5-day-a-week psychotherapy with 3 clients a week. Like a deep psychotherapy with eating disorder clients. And within a week of that job, I was like, oh my God, how could I have not wanted this I was so inspired, so turned on, so transformed in terms of what I had thought versus what I came to know. And it has become a part of my life's work. And I just have such deep reverence for people who struggle in that way. And it wasn't a struggle that I had personally, although my internal struggles matched often, but didn't have the external presentation in terms of the symptoms. But so sort of by chance.
Must have been meant to be.
Yeah.
So how would you say that people come to develop an eating disorder?
I think it's an important question to ask because I think there are a lot of misconceptions about eating disorders, as we're both well aware of.
Very much.
It's yes, and you could probably speak to this as maybe I should listen to your answer to the question. But from where I sit, I would love to hear your thoughts on it. But it's such a medley of things that can create an eating disorder, and stemming from genetics, epigenetics, temperament, neurobiology, and then from a psychological point of view, really just like a way to help manage an anxious and overwhelmed nervous system, and to manage difficulty processing feelings. And when we think about it, and I think we have so many limitations about what we understand about all of the things that go in to contributing to an eating disorder. And then, of course, the culture and the media and all of these things that go into that. And yet then another place in terms of the genetics, and I think of the epigenetics and the places of pain from generations even long before us that inform the ways in which we learn to manage pain and that we carry with us into our bodies and into ourselves. And so I think the eating disorder there are so many different pieces that inform, how we develop an eating disorder. But I would say those are a part of that medley of things that.
I would absolutely agree. I think it's the stereotypical picture of people that people have about, somebody just wants to look thinner and look prettier is almost universally untrue.
Yes, I couldn't agree with you more, and thank you for saying that. Yeah. Another one I'd like to add to that is the one that people say most often is eating disorders or anorexia is about control. And I actually have a problem with that, because when have you ever heard a person in our culture speak about control without it being a judgment or a criticism? Like, they're a control freak, they're so controlling. And I think fundamentally it's a disorder that's fueled by fear. Like 100%. There's so much fear. And of course, control becomes a piece of that, because when we're afraid, we're desperate to get some semblance of control in our lives. But if we think about it as fear, I think it elicits our compassion, because if you think about a scared child, right, you want to care for that child. You want to love that child. You want to make that child feel safe. But when we think of someone wanting control, I think we back off a little bit and we judge. So,
yes. Yeah, I would agree. My own experience was, I would say the word control probably doesn't particularly come into it. It was something to hold on to when the world around me felt like I didn't fit, it was too scary, and I needed something to hold on to, something to be good at, something that I could achieve at. And I needed to stay small, to be not seen, to be safe. And then the added effects of numbing all my feelings and being good at something and succeeding at something kind of created a superpower, or so I believed in my child mind at the time.
Yeah.
But it was never really about control.
Yeah. Oh, so beautiful. Thank you for sharing that. And so good for that child, right? I mean, good for you for finding, what torture you experienced. And yet, thank goodness, I imagine that probably saved you in some ways.
I think it probably did. And I think that most people who develop an eating disorder, they don't think, I want an eating disorder. I don't actually know anybody that thought, I want an eating disorder. It is something that fulfills a need that's not being met in some other way.
Yeah.
And I think it's a survival response, to be honest, for most children and young adults.
Absolutely. And what's the first thing we have access to, right?
Yeah.
Food in our bodies.
Yeah. Yeah, it is something that we can have an input about.
Yeah. Yes.
So let's talk about how people can recover, because I personally believe that anyone with the right support can recover. I don't believe that, I know there's talk about people having terminal anorexia and things like that, but I don't believe there is no hope for anybody. And I believe everyone can recover. It's not easy. It's never, ever easy. It's quite simple, as in it's straightforward, but it's never easy.
Yeah.
So what do you see?
Sorry.
No, carry on.
I just wanted to join you in that, Julie. And I think that it is never, and you'll hear it, as a therapist, and you hear it in the sort of clinical setting about like someone being untreatable or so defended or so, right? And I think that is our own protection against our own inability to provide the care that's needed. And I join you completely in that there is no one who is untreatable. It doesn't exist. And yet there may be such limitations to the therapist, such as myself, what I have access to in terms of what I know how to provide, or the therapeutic or healing container that a person lives within, in order that it may not resource them enough, right? And so I agree with you completely. It's never about the individual, and yet the individual, as you and I both know, many individuals do not survive an eating disorder as well, because of the limitations that we have in the care that we can provide. Yeah.
What do you see as the key ingredients to treating people who struggle with eating disorders?
I just want to ask all these questions to you instead.
My answer will always be love. Always love from me. Always learning to love
Yes.
who you are
Mm,
is the most important thing, because when you love
mm.
who you are, you want to look after yourself.
Yes. Oh, yes. Thank you. I'm so glad you answered the question. I'm just gonna agree with you. I'm just like, yes, yes, and yes. And thank you. And this is it's such an interesting thing, because you're talking about love, and a mentor of mine, Adele LaFrance. I don't know if you are familiar with her work.
No.
They're doing something called the Love Project, and she has been treating eating disorders for several years, and is the lead trainer at the Imperial College in London of psilocybin for eating disorders, and the MAP study for MDMA for eating disorders, and other studies. And they're doing something called the Love Project, and it is about. I mean, she is trying to bring back the word, the 4-letter word of love, the forbidden word, into the clinical realm. And she talks about, and I know from my own training from Carl Rogers, who, such the humanistic approach of unconditional positive regard. And that's what he called it, because it was like the safe thing to say, versus love. And yes, love. And yet at the same time, love, people have been so hurt by love. And so love can have boundaries, and love can be safe, and love can be intimate without being sexualized. There have been so much hurt. There's been so much hurt in the name of love.
Yeah.
And so it's something, but I think it's something that our field can be afraid of, right? And yet I would just fully join you in that, in terms of the process of, relearning, because we all are born loving ourselves, right? But relearning that love of self, and a loving environment, a loving therapeutic environment, not therapy for everyone. I mean, people recover from eating disorders without treatment, absolutely. So, but I would say that. So I would join you in that. Absolutely. Maybe we'll just stop there, because I think I think you've got it. I think you've got it. But maybe I'll add some nuts and bolts. Maybe I'll add in some nuts and bolts to the love. How about that? Flesh that out a little bit in terms of the love for self, right? And so, which is like a regaining. So much of, an eating disorder is a loss of trust in self, and a loss of trust of others. And it's there, and it's within us, right? Just like the love is within us. And yet it's a reconnecting with that. And so through that internal process, and then working relationally, through relationships, whether it be through a therapist or other relationships, in terms of healing relational wounds that have reinforced that experience of mistrust. And a lot of the work that we're doing is with families, caregivers, loved ones, to support them in supporting the individual with their internal healing process. And so bringing in anyone that is welcome into the treatment, in order to coach them and guide them, to empower them to be a loving container and a loving support for the person who's struggling. Because as a therapist, and with the limitations of insurance coverage and all the other things, I may have access to someone for 45 minutes once a week, whereas family members and caregivers are roommates, or partners, are the people who are really around to provide that more ongoing support, and have a stronger neurobiological connection. And so supporting loved ones in that process of helping, of making them feel empowered, and then supporting their loved one in their internal process of connecting with their self-love. So I would agree with you on that.
That's fantastic. And I agree. If you have got people around who can be coached or helped to support the person with an eating disorder through their recovery, that is super, super helpful. I do find with a few of my clients, because in particular anorexia is a very isolating illness, bridges have been burnt, and the people that they would have liked to have been there are no longer. So what other ingredients would you add into the mix if that's not an option?
If that's not an option, I would still say that I guess I would join you in that, and also push back a little that there may be bridges that have been burned, but that doesn't mean that, there is nobody. And so, and so I would just say that there may be options still. I think it's just to really dig in and source that, like, what is somebody who can provide some level of support, even if it's not the people. Oh, are we, was that frozen, or you froze?
It's kind of jumping in and out a little bit, but it's not too bad, so we'll be fine.
Okay. So I would say, so I would say that, to try hard to see if there's anyone that can be enlisted. And that said, I think that a really important ingredient is, in terms of, and using, the frame of, internal family systems, or whatever frame that is a framework of different parts of the self. If we think about, the eating disorder as a protective part of the self, and as what you talked about so beautifully, is like something to hang on to, right? A way of, it was like a lifeline, a way of managing, a way of navigating. So when we, oftentimes what may be required when someone gets really far along in a struggle with an eating disorder might be a higher level of care might be needed. And when that, higher level of care is needed, to really try to do everything that we can to engage the part that is, using the eating disorder as that survival strategy, to enlist their feeling of safety, and to try to get that part of the self on board with engaging with a higher level of care. There's so much treatment trauma where people are, forced into higher level care, force fed. And look, I also have so much compassion for the people who, the caregivers and the providers who do that, because, this anorexia, and it's particularly, and eating disorders, have the highest mortality rate of any mental illness. So people get scared. And so we want to lock it down. We want to get people safe. And yet that can re-traumatize. So as much as we can, in all the ways that we can, really, really, honoring and acknowledging the importance of the eating disorder and how much it is needed, and try to engage that part cooperatively in getting a higher level of care. I think that is an essential ingredient in eating disorder treatment that is not new, but is unfortunately not being practiced often enough.
Yes, yeah, and I would agree. There is a lot of treatment trauma, and I think that everybody who has lived in an eating disorder, that eating disorder has served them, and it has served a purpose.
Yes.
But there does come a time when it stops. And so it is hard to let go of something that was so helpful and did really serve you and met what was probably a pretty big need.
Yes.
So
I think that I just wanted to piggyback on that. And so to just strip something away, to take away something that has been so important, right? We can't do that, because if we do that, like in traditional inpatient settings where it's okay, if you eat, you get the reward if you get to go out in a pass and you get to go out of the hospital or something, things like that. That can work in the short term, that short-term reward, but you get out of the hospital and then that part comes back and says, okay, I'm taking over again. But if we can enlist that part that was once adaptive and becomes maladaptive, and really give it the love that you talk about, and the care and the acceptance that is needed to then offer that part a different position, because
Yes.
an eating disorder is fierce and powerful and strong, and so if we can redirect that power, right, it's like we're unstoppable.
Yeah,
But
definitely.
it's hard to change roles. Yeah.
It is, but it's not impossible.
No, far from.
So this is a part of our conversation that I'm very excited about. Tell me about your interest in psychedelics for the treatment of eating disorders.
The main reason I'm interested in psychedelics for the treatment of eating disorders is because of the limitations of the treatments that we have available. So, as you're saying, I want to reiterate, people absolutely recover. Many people recover from an eating disorder. Some of those with treatment, some of those without. So there are just many, many ways of recovering. And there are people that we are not reaching with the current treatments available. And also there are people that we're not reaching quickly enough, in that, we're still looking at the, length of treatment for recovery for anorexia is 7 to 10 years, right? I mean, I'm not saying that's for everybody, but that's what we're looking at in terms of treatment trajectory, and it's unacceptable in terms of, and then also that people are dying. So my interest in psychedelics is, first of all, because I think there's emerging research that is promising, and that we are limited in what we have access to, and that people are suffering for too long, and that people are dying.
Could you tell us a little about the promise that you're seeing in this emerging research?
Yeah, I mean, there are studies being conducted. The only psychedelic that we have legal access to right now in New York, which is where I am, is ketamine. And there has been research on ketamine. So ketamine is a legal anesthetic that is prescribed for off-label at a sub-anesthetic dose for off-label treatment for treatment-resistant depression, anxiety, post-traumatic stress disorder. There have been studies with using ketamine for anorexia in an inpatient setting that have shown ketamine paired with deep affective psychotherapy, where the outcomes are very promising. Same with from what is being done there's research being done on psilocybin at the Imperial College of London for anorexia. MDMA, MAPS is doing research. The Multidisciplinary Association for Psychedelic Studies is doing research on MDMA for anorexia. I think that, to me, Gould Dolan, who is at Johns Hopkins, is doing really interesting research from a learning theory perspective on all of the psychedelics across the board. And what they're finding is that when someone engages in psychedelics, all of the psychedelics, it reopens the critical social learning period. And these periods are from the ages of 2 to 7 and adolescence. And then pretty much these windows in the brain, it closes. So it's very hard when something has been learned. And when we think about, what you talk about is, that lifeline, that thing that saves us, has been learned as an adaptation of a way of managing. And then the brain sort of firms in around that. It can be very hard to access with the traditional therapies that we have access to. And so what we see from these various different medicines is that critical learning period can be reopened, and there is a metaplasticity in the limbic system. So an openness in the more primitive, in the more activated parts of our brain that we can, so when we pair something like a psychedelic with really deep affective psychotherapy, we can re-enter into those, those critical learning periods and create really, really powerful shifts, even if it's like a tiny shift, to see like, maybe to see things just a little bit differently. And so it gives us, I think about these psychedelics as like a lubricant for access to self. And if we think about self as, from all the spiritual traditions, we could think about it as Atman, soul. If we think about that part of ourselves that is untouchable by an eating disorder, by trauma, by anything that cannot be taken from us, that cannot be given to us, that core self that we all have, if we can have medicines that can give us greater access to that, we fundamentally have greater access to healing. So anyway, so all of those are reasons why I'm interested in these medicines and the possibility, the potentials of these medicines for healing.
Thank you so much for sharing that. I myself, later on in my recovery, not after I had weight restored, did actually have psilocybin therapy, which, yes, did help me immensely with going back into my younger years and seeing my truth, seeing who I actually was without the fantasy of coping mechanisms that I had built up around everything, and seeing who I was underneath all that. And so, yes, I totally hear and see what you're saying there, having access to self, seeing who you really are without all the layers of conditioning and coping and all that sort of thing. And that does give a greater strength to that authentic, I suppose, pure version of you, without all the bullshit that's landed on you from every direction.
Yes.
So I can see that that's very helpful.
Thank you for sharing that. And
with my own experience, as I said, I was fully weight restored.
Yep.
Is there limitations for people to have this treatment, if obviously in places where there is access to it, on where they are in their recovery and eating disorder?
I'm glad you bring that up, Julie, because it's really important. And what I would say second to, I'm so hopeful, and I think there's so much possibility. And yet I would also say, proceed with caution. Because first of all, as you're saying, as for these medicines aren't legal in many places. And not only, but regardless of that, the set and setting and your own safety and your own bodily safety are extremely important. And so I believe that when somebody engages in this, there has to be, particularly someone with an eating disorder, there are people who are not weight restored, who go and have, a psilocybin experience, an ayahuasca experience, and can experience like a completely transformative experience and either have an instant recovery or a huge step on their way to recovery. That is not everybody by any means. There are some people who that happens for, but it can be extremely dangerous. And with people who are not educated about eating disorders, who are not, do not, when someone's not medically cleared by their treatment team, and for some people, it really isn't safe. And I really think that we unfortunately, we do have a ways to go in terms of really creating the standard of care for using these medicines, so that we do have the understanding of the elements of an eating disorder that are very, specific among different, mental health struggles that we have. And so, set and setting is everything. And so it needs to be, so it's not for everybody. And also, I think you bring up another important point, is that was, it depends on the medicine too. And some of the medicines may be, like, one of the things about ketamine, which again is not approved for eating disorders, but can be used for someone who has, oftentimes there are co-occurring challenges. And I hate to even use the word, all the mental health diagnoses, but for the purpose of simplicity, when someone has like a post-traumatic stress disorder or depression or anxiety, those are things that ketamine can be used off-label to treat. And so when the beauty about, ketamine is that people can be on other medications, where that's not the case for some of the other psychedelics, where it can be done, currently legally in certain places, so there can be a medical provider on board who is monitoring and who also can assess for safety for the client. And so yes, I think you're bringing up a really important point, that first of all, there are different medicines, and different medicines may be better for some than others. And there are some people or some phases of the treatment where it really may not be appropriate.
Yeah.
And there's a lot of unknowns. And anybody, sorry, I just wanted to say that I am by no means an expert on psychedelics and eating disorders, and nobody is, because it's too new. So,
yes, it is very new.
Yeah.
So I think proceed with caution is very sound advice, and I certainly don't think it's something to kind of do without a therapist or somebody that knows what they're doing.
Yes.
It's certainly, definitely don't go and get some and just try it. That's
not the message we're sending.
So we've just covered a lot of the considerations, but are there other important considerations for using psychedelics for the treatment of eating disorders?
Well, one of the things that we're doing with ketamine-assisted psychotherapy for, that's being used for, the off-label treatment of major depressive disorder, post-traumatic stress disorder with people who have eating disorders, is we are engaging in care with loved ones, family members, other people, to support the process of using the medicines. So to create, again, to go back to that healing container, is that so oftentimes when people have an experience, it can be, it can open up, a deep rage, or like, a lot of feelings that have been unavailable, or it can, connect people with a lot of grief or other feelings that have been really well managed by the eating disorder. So we want to really educate family members or loved ones in terms of how do you support people as they go into this journey, and what does support look like when they come out. And so that, I think that's really an important part of, with any struggle when people use psychedelics, but that there is support around them. Even just one identified person who can be that support. Because we can't do this alone, and so the therapist being an important one of those people, but really trying to identify at least one person in the community to support in the process.
I totally agree with that. Yeah, I suppose it's a bit like opening a can of worms, isn't it? You're having access to parts of yourself that you have very effectively and neatly tied up in a package and not opened for many, many years.
Yeah.
And that's a lot. That's a lot to deal with. That's a lot to look at. And you definitely need help to go through it. It's, I think the first experience I had was I felt shell shocked for quite some time. And I had a lot of processing to do.
Yeah.
And I did need and receive a lot of support. Not just the day I took the medicine, but in the preceding days and weeks afterwards, because there was a lot to go through. So,
yes.
Yeah, somebody there, support is hugely important.
Yes. Yes. And, when there's an eating disorder, it affects the whole system, right? It affects everyone. And so when someone does a psychedelic journey, that affects the whole system, right? So someone comes out and they're like, I am so angry. I am filled with rage, and then people are like, put that person back in, I don't want that. Like, that's not, I don't want, like, this medicine has totally derailed them. This is a terrible idea, right? So we can provide support, like welcome the rage, like support them. And like, we've got you hold them, and we've got you. We've got you to support them in this process, and so that they can feel resourced, right? Like if someone goes in and they come out to their partner and they're just like, and so we're trying to, or they think, oh, I need to disrupt everything. I need to change everything in my life, So we want to really support the person and the system to slow things down, to allow for that space of integration, as you're talking about things getting turned so upside down. That we can really, the integration, as far as I'm concerned, is where it's at. And so like you can have these really powerful experiences, but as you're saying, for so much time afterwards, we need a lot of care in how we make use of that, of what our learnings have been. And so the more we can support the system in supporting the individual, and we as therapists support both, I think that it can be far more healing and less, because it can create ruptures, just like the eating disorder itself can, as you said, can create, ruptures.
Yeah. Where would you like to see, because none of us know what the future is going to bring, but where would you like to see this, the treatment, using psychedelics in treatment going for eating disorders? How would you like to see that happening?
From my little position of being a clinician who works with this and has done some work on my own, and as is following the research, I would like to see, these medicines become legal in a safe way, and to have the approach, which I think MAPS has done a beautiful job of, but have the process be as important as the medicines in terms of the treatment interventions. And I would like to see these medicines safely and more widely available when, and when we have more clarity in terms of how best to make use of them. So that, and then to really support, individuals and communities in making use of them in a way to have greater access to self, which will inevitably have greater access to individual healing, collective healing, and planetary healing.
Lovely. I totally. That would be wonderful, wouldn't it? And I do believe that psychedelics in particular do have so much potential therapeutically, a huge amount. So I do hope that many countries follow the example of like the Netherlands and stuff, and allow this sort of thing to be available for treatment, even if it's not just freely available for people to just go in the shop and buy, but to actually have therapeutically, would be hugely beneficial, I believe.
Yeah. It would be something, yes. Be a step.
Yes. So if people are interested in learning more about everything we've spoken about today, how can they learn more?
Well, I think great places of learning is to go to MAPS, to the Multidisciplinary Association of Psychedelic Studies. If you want to learn more about ketamine, I think the KRIA Institute is a wonderful resource with lots of articles, and Raquel Bennett is a leader in the field, not in eating disorders, but in terms of really, high integrity use of ketamine and ketamine assisted psychotherapy as a treatment. There are many resources, but I think those are two places that I would start in terms of people's interests. Yeah.
And if people are interested
sorry.
Carry on.
Go ahead. No, that's it.
I was going to say, if people are interested
there
in
are many
working
others.
with you.
Yes, they can reach me at erikamalm.com, my name, erikamalm.com. And it's myself and I have a collective of providers who provide, and we work because most psychedelics are not legal in New York, we work from a harm reduction perspective to really offer people education, because we're finding that so many people, there's so much hype around psychedelics that people are turning to the underground and doing these things anyway. And so we want to be an accepting environment to support people and providing them with education and discuss with them about how they're approaching things, and that they can talk to us and that we can help them to integrate their experiences, because people are doing this. And so it's similar to like in alcohol, when people are using any sort of substance, a harm reduction approach in terms of how we help people to do it most safely.
That's absolutely fantastic. I will definitely put your details in the show notes so that people can contact you should they want to learn more. Is there anything else you would like to share with the listeners?
I guess I would just share that if you're someone who is struggling from an eating disorder and you haven't been helped yet by the treatments that are available, don't give up. And that, many people are working fast and furiously to try to find new treatments. And like we said in the beginning, if you haven't responded to current treatments, it's not because you're untreatable. It's because the right provider or the right treatment or the right healing container has not been made available yet. So don't give up.
Oh, yeah, I totally and utterly agree with that. It's not your fault. It's not your fault you have an eating disorder. It's not your fault that you haven't recovered yet. And there is always hope.
Yeah.
Well, Erika, thank you so much for coming and chatting today about
You bet.
this. Oh, sorry, dropping my pen. This exciting possibilities that are coming with eating disorder treatment, and anything that helps people stop existing in the hell of an eating disorder and actually start to live freely is very much worth investigating and pursuing.
Yes.
So yes, I really appreciate you, and thank you so much for sharing what you do with us.
You bet, Julie. Thanks for having me.
Thank you. And thank you, everybody, for listening. I will put Erika's details in the show notes, and I will see you next week. Thank you so much.